Have a look at this video over here.
We responded to a motor vehicle collision with two elderly ladies.
This, unfortunately, is an all too common thing, occurrence that happens almost on a day-to-day basis in our jobs as healthcare providers. And while it's not desirable or pleasant, it is an inevitable part of our jobs that we have to deal with on an everyday basis. Confrontation is something that not humans are generally not wired for to begin with, and no one wants to be a part of it, and no one desires it. However, as I mentioned previously, it is inevitable, and it is something that we need to equip ourselves as healthcare providers in navigating through effectively to not only build that relationship back of trust, but also stand firm of what we will and we won't tolerate. To explore more on this topic, stay tuned for the rest of the video. Welcome back to my channel, my viewers. My name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that helps healthcare providers from non-English speaking or English as a second language backgrounds help become better, more empathetic, influential, and compassionate communicators, and also culturally sensitive communicators, in order to build better relationships with their patients, stand out as a person of excellence in their workplace, and as well as that, be able to earn a reputation as being someone that they can trust, and also be delivering consistently good patient experiences. So in the very beginning clip of the video, I looked into a situation that's quite common and something that happens almost on an everyday basis as a healthcare provider. And the underlying theme for all of this is the concept of confrontation. So confrontation is not something that everyone desires and not something everyone wants to be a part of. We want to really be in a position where we are building good relationships with our patients, people are trusting us, people are respecting us for what the service that we're providing them, and many other factors. So we want to keep the vibes quite positive. However, that's as much as we would like that, and it's a wishful thinking kind of scenario, it doesn't always happen like that. And it is something that we have to live with and deal with on an everyday basis. And sometimes we can be the initiators of confrontation ourselves. And the bottom line of confrontation is, as a healthcare provider or even otherwise, if you're in any kind of service-based role, your bottom line or the main objective of confrontation, or how to sort of overcome it, is what you will need to do is to diffuse or de-escalate the situation, and with the aim of ultimately achieving a win-win outcome for both parties. So in this case, it'll be your patients and yourself. So you want to be able to, at the back of your mind, you should always be aware that you are here to diffuse or de-escalate a situation that's gotten out of control, and you want to get to a point where both parties in the interaction are achieving a happy or a positive outcome. So in this video, I'm going to cover specifically on what, as healthcare providers, we tend to do unconsciously, and it almost always goes against when we are trying to navigate and work through any form of confrontation. So think of it as this being like all the don'ts, things that you shouldn't be doing when you are trying to confront or handle confrontation of some sort. All right, so let's get straight into it. The number one mistake that I have made myself as a healthcare provider, and also I see other healthcare providers doing, is they try to deny and dodge responsibility of the situation that has taken place. Now, I'm aware that that may not always be the case. So say, for example, not too long ago where I live in Australia, this was sometime last year or earlier this year, we had a massive power outage. And I think I have spoken about this in one of my past videos. And at that point, when we were speaking to a lot of our tech support service providers, a lot of them, what they said was they apologize, and this is a national outage. But what they always tried to say was that we are resolving it, we're trying to get to the bottom of it, and we'll keep you updated as soon as we have an answer. And this can well happen even in a healthcare setting. So say, for example, you have had a patient who was actually sent through like a request of some sort to conduct some type of test. The patient rings you and says, I just want to make sure that the request has been received. So the person speaking on the other line might say that, oh, we don't see it I'm not able to see it from our end. And then it's absolutely okay and valid to ask the patient, are you sure that you sent it, and are you sure you sent it to this particular email address, or whoever your provider was, they sent it to this email address. That's absolutely fine. But what we tend to do at that point is unconscious, and I've done it before as well, that we can blame anything and everyone under the sun. So we can say that, oh, there's been a system problem, maybe you entered the incorrect email address, maybe the fax number they provided that was provided was incorrect. And we also sort of almost always tend to deflect the blame on everyone else rather than take responsibility and take ownership of the challenge that has occurred. This does nothing more than frustrate the patient and put them in a far worse of situation than what they are. So it's only going to add fuel to the fire. So they're already coming to you in a bad, negative, and quite a upset frame of mind. And you're only going to make it worse by putting the blame back at everybody else except yourself. So it's important that you take ownership and responsibility for what has happened, even though you may not be able to fully resolve it to begin with. It is important that you take ownership and responsibility of what has happened, and definitely never blame your colleagues or anyone in your organization. And this sort of brings me into the second part, that us as healthcare providers, when we do that, when we hold someone else responsible for a challenge that has happened that may not be the other person's fault, it makes the organization that you represent not look very good. Because at the end of the day, when a patient is speaking to you, or if you're a healthcare provider, you represent not only yourself, but also the organization that you work for, whether it's a clinic, whether it's a hospital, whatever. So that makes the whole reputation or the brand and the presence of that provider not look very good. So and that's why it's important that even though you may not be able to resolve the whole situation to begin with, it's important that you don't put the blame on anything and everyone, especially the organization as a whole, and try and do as best as you can, take ownership and responsibility for it. And the other thing that a lot of providers tend to do is, especially when they have a patient who's very, very emotional and very, very sensitive and hyped up, and they are looking for immediate answers, they tend to overpromise and underdeliver. So what that means is sometimes, you might, just to pacify the patient, you might just tell them what they want to hear. And you might say, if something, say, they are looking for a report to be released on a test that they had done recently, or, the opening spot available for when they say want to come by for some sort of treatment. You just give them, you just make promises and say to them, this has been done for you. You can come in a couple of hours and do whatever you need to do. Only to find out when they get there that that's not been the case, and what was told to them was complete false information without actually checking it. So over-promising and under-delivering is also, it just impacts your integrity in a not very good way. So that is also something that we need to 100% steer clear of. Another huge one is projecting our emotions back at patients when they are in a heightened state of, being angry, being frustrated, being upset, and all that. It is quite natural for us to, because we tend to, even though we don't really want to, we do tend to take things personally. And what we shouldn't be doing in that situation is not get upset or take it to heart, because the problem is not the patients themselves. The problem is what they are dealing with, and that's what is causing them to become frustrated. And it's not an attack on you personally. It's because of the situation that they're in that they are looking for some sort of answers on. And what we should be doing, instead of, getting, like I mentioned in one of my previous LinkedIn posts where I said that you should never say to an agitated patient to calm down. Same thing, that you should not, get to where they are, and, you should, if they are being loud and vocal and everything, you shouldn't aim to do it tenfold. So you need to keep your voice sort of down and stay calm and be relaxed and be quite firm and be assertive, but there's no... but when you project your emotions, even if you're feeling, quite stressed, quite anxious yourself because you're being sort of but it can feel like you're being attacked, the last thing that you want to be doing is actually raising your voice up to your patients, so that nothing good can come out of it. And similarly, another thing to absolutely avoid is when a patient is talking to you, you should not interrupt them. Let them vent, let them speak as much as possible, get it out of their system, and at the same time, sort of, you should be taking like mental notes or even physical notes if there's needed, and then that's what you should be doing. Just give them that space or whole space for them to really express themselves. And the last one definitely is that we as healthcare providers, again, we might be doing this consciously or unconsciously, is the tendency to dismiss or gaslight when a patient is telling you something. So, for example, if you're, say, a GP, or if you're, say, a radiology technician, and you've got a patient who's coming in there, and they are complaining about needing to have a scan done of, or requesting a scan to be done of the pelvic area because they're experiencing a pain or discomfort in that part of the body. A lot of healthcare providers, whether it's GPs or whether even if it's radiology technicians, can inadvertently tend to say things like, have you tried to lose weight? Have you tried to, how do you want me to prescribe? I mean, if you're a GP, obviously, have you tried this particular type of medication? Have you, especially for a woman, it can be coming across that it's all in your head, or, especially when women are moving more towards the end of life, like menopause and perimenopause. This is a very common form of medical sort of gaslighting and dismissing that happens. And even, as I said, I've mentioned examples of this previously in my last videos where healthcare providers can assume that you're experiencing, the radiology technician can say you may be experiencing these cramps without actually doing the test, to just assuming that you might actually be pregnant or want to get pregnant, or just throwing diagnosis that is not even accurate, and you can't really establish that till a proper testing and evaluation is done. So again, dismissing and gaslighting is something that's absolutely to be avoided, especially if it's a confrontational situation when the patient is already agitated, fired up, and in a frustrated state of mind. If you do want to learn a little bit more about medical gaslighting, I've got a playlist over here where I cover this in a lot more detail. So, going back to what I said in the very beginning, is the fact that as healthcare providers, if we are dealing with a patient who is agitated, frustrated, angry, and upset, your main aim should be to diffuse the situation and let it not de-escalate, or de-escalate it, let it not get worse than what it is. You have to literally nip it in the bud, and you have to aim towards getting to a win-win outcome. And always remember that when a patient is looking like they're taking out their frustration on you, it's got nothing to do with you per se. It's about the situation that they've been put in for reasons that may be the whole organization's responsibility or one of your colleagues' responsibility, but never throw anybody else under the bus. What you can do from your end is really stay calm and stay grounded and work towards how you can best support your patient in that situation without yourself getting emotional and hyped up and everything like that. So in a forthcoming video, whenever it happens, I will explore what are the best ways to actually navigate through confrontational and conflict-based situations in a positive and empowering manner for everybody. So in order to check that out, as well as any of my other weekly videos, make sure that you hit the subscribe button and the notification bell in order to stay up to date on what content is being posted. So until next time, thank you very much for your time, attention, and presence, and I will see you then.